Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? You guys know in my past life, I lived a lot of experiences. And one of those experiences was working at a center of excellence here in Houston, Texas. And that is where I met my guest today. This is Dr. Kristen Aliano Messina. She's gotten married since I met her. She was Dr. Kristen Aliano when I met her. And now she is a plastic surgeon in Frisco, Texas. Hi, how are you?
Good, thank you. How are you?
I'm doing good. I'm so happy to see you. I haven't seen your face in years.
I know. Thank you so much. It's great to be here. Thank you for inviting me on, and congratulations with all of your success with the podcast. It's wonderful.
Thank you so much.
You're welcome.
I wanted to bring you on because I saw on your Instagram, of course, I was stalking you, and I was like, oh my God, she's doing so many amazing things. And one of those things that you're doing that I wanted to talk about today is what you're doing with regenerative medicine. And we haven't talked about it a lot on the show. And my listeners, they love learning. They love hearing the newest, the greatest, everything that's happening in the industry. So I want you to tell us what is going on with regenerative medicine and what should we be excited about?
Thank you so much. That's a great question. So just to give you a little bit of background, I'm part of an amazing new organization called TriCellX. We are a multidisciplinary and interdisciplinary medical practice. We have three main divisions. Luminex is our plastic surgery and aesthetics division, and I serve as the chief of plastic surgery and aesthetics at the organization. And then we also have Orthodynamics, which is our sports medicine pain management component. And then our third component is called Juvenex, which I also am very heavily involved in developing. And that focuses on longevity and wellness. And what really ties all of these three different disciplines together is our quest for developing and innovating the field of regenerative medicine. Regenerative medicine involves a variety of different therapeutics that can help improve people's well-being, as well as improve cell turnover, wound healing, and repair of a variety of different tissues and body systems.
Wonderful. So before we started on the air, before we got to recording, we were talking about something that you're involved in that I was a little familiar with from my past life, right? And that was about stem cells. And we haven't talked too much about stem cells on the show. And I want to dive into it. I know my girls who are listening, they might be interested in stem cell treatments and kind of wondering, what is that? What are stem cells?
Great question. So stem cells are undifferentiated cells. They're found in a variety of different tissues in the body, including the bone marrow and adipose or fat tissue. And these cells have the ability to become other types of more specialized cells in the body. They also play a role in immunomodulation. They can help to reduce inflammation in the body. They can help to promote cell turnover, wound healing, repair, and regeneration. So there's the potential for them to have applications in a wide variety of medical conditions, from aesthetics to people who have chronic joint and orthopedic conditions, to autoimmune disease, to traumatic brain injury. And right now, there's a lot of regulation with regard to the use of these therapies in the United States. And we can, of course, chat about that since I think that's a big component of the field at this time. But there have been over 1,200 published studies that demonstrate the efficacy of stem cell therapy.
So one way that it was described to me, and tell me if this is accurate, because it simplified it to me so much that if it's true, I want to simplify it for my listeners. So the way it was described to me was that stem cells serve kind of like as ambulances, and they go to wherever in your body you're having some sort of emergency or issue or something that they need to address. And then once they get there, they figure out kind of what's going on and they convert into whatever type of whatever it needs to be to help with that situation. Is that accurate?
Yes, that's a great analogy. And stem cell therapies can be given both intravenously as well as in a targeted fashion. So, for example, if somebody has a chronic joint issue such as arthritis, and not necessarily a bone-on-bone situation, but somebody who maybe has some loss of cartilage, you can actually inject therapeutic products into the joint directly and deliver those cells as well as cytokines and growth factors and other components directly to the area where there's been injury or inflammation. Other treatments focus on, like, as I mentioned, intravenous applications. And then they can also be injected subcutaneously as well, which in the aesthetic world can be very helpful in potentially promoting faster recovery after certain procedures, such as lasers or chemical peels. Again, these are not necessarily allowed in the United States yet, but there is evidence that such treatments would help individuals.
And there's different types of stem cells, right? I know I'm sure our listeners, and we've all heard of umbilical stem cells and what we just recently were talking about, fat-derived stem cells.
Yes.
So what are the differences?
Great question. The concentration of stem cells in adipose tissue is actually extremely high. It's higher than what you might find in bone marrow. There are a lot of orthopedic surgeons as well as sports medicine doctors who will actually drill into the iliac crest and be able to obtain stem cells out of the bone marrow there. It's a type of therapy called BMAC therapy. But if you compare the concentration of undifferentiated cells in bone marrow compared to adipose, you'll see that in adipose tissue, it's actually much higher, which is great because obviously everybody has adipose tissue. And especially with the epidemic of obesity in the United States, there's obviously a lot of patients who have essentially reservoirs of their own stem cells.
And who doesn't want to get rid of a little bit of fat and do something useful with it?
Exactly.
But like we were talking when we were off air, is that there's a lot of regulation on it.
There is.
When I was a little bit involved in it, it was early, like 2015, 2016 era, and there wasn't such a crackdown on it. So why don't you tell us a little bit about kind of what's going on? Why is the crackdown? Why are we not allowed to use our own fat-derived stem cells for treatments on ourselves? Why not?
That's a great question. So during the 2010s, the field of regenerative medicine was really exploding and taking off. And while that's great for innovation and being able to provide patients with a variety of different therapeutic options, there were unfortunately also a lot of bad actors in the field. And there were practitioners out there who were promising patients treatments that were not actually proven to be efficacious. There were essentially many charlatans out there that were taking patients' money for treatments that were not had no scientific backing behind them, were not actually providing a benefit. There was also concerns of what type of conditions are these different facilities providing treatments in. And unfortunately, there were patients, for example, at a med spa in Arizona who wound up contracting bloodborne diseases such as HIV and hepatitis C from non-sterile practices. And so the FDA during the pandemic, 2020, 2021, really wanted to crack down on really protecting the public from these types of situations. And so currently there is a great deal of regulation in the space. Generally speaking, stem cell treatments are not allowed in the United States unless the provider in their office or their institution is working with the FDA, specifically with an investigational new drug permit or IND. And there also generally needs to be institutional review board research studies as well. So that way safety, efficacy, outcomes can be tracked and everything can be monitored appropriately. So it's really because of that, in the interest of protecting the public. And so what my organization is doing is we're trying to work very closely with a variety of different governmental agencies, not only the FDA, but also with the Department of Defense and the U.S. Army, to be able to help to develop some of these products and get them not only to military personnel, but hopefully in the future, eventually to civilians as well.
How cool is that? How did you get into that? How did that happen?
Thank you. That's a great question. So I feel so blessed and so lucky to be part of this organization. I randomly had gotten connected to the team, honestly, through, this is going to sound funny, but an AI generated email. I'd gotten an email about this organization, and I live in Frisco. So, when I received this email about an opportunity that was going to be coming to Frisco at the Star, which, as you mentioned, it's the whole 92-acre complex. That's the headquarters of the Dallas Cowboys. I was really excited because I literally could walk here if I wanted to from my house. But not only that, but I was really excited because I knew that the opportunity was going to enable me to combine not only my clinical experience as a plastic surgeon, but also my research experience as well. I have an extensive background in basic science research as well as clinical research. I also had the opportunity to work at Pfizer when I was younger. And so just to be able to combine also like that pharmaceutical experience into what I'm doing now has been amazing. And so I feel really lucky to be able to be doing something innovative. And at the same time, also I get to take care of patients every day.
I love that. That's so beautiful. So when I met you, you weren't married yet. You were not who you are now. So why don't you catch me up a little bit about, how have you been in the last 5 or 6 years?
Absolutely. Well, let's see. I wound up meeting my husband when I was in my 4th clinical year of training at the University of Texas Medical Branch in Galveston. He's not in medicine, but he is a native Texan. And as you probably remember, I'm from New York. So,
yes.
At the time, I was still fairly new to Texas, although coming up this June will be my 10-year anniversary here. And it's been wonderful. My husband and I wound up getting married in my chief year of residency. And then during my last year of training, my husband had gotten promoted in his company and they asked us to move to Dallas. So we moved here in the fall of 2019, actually right before the pandemic began. And then about almost 4 years ago, we moved from Dallas itself to Frisco, which is one of the suburbs just north of Dallas. And I had my daughter, Gianna, 2 years ago, and then I'm actually expecting another baby this June.
Oh, congratulations.
Thank you so much.
How do you love having a family, having your practice, being a mom, all of the things? How are you balancing?
Thank you. Well, I love it. I love everything that I do, whether it's my home life or my professional life. I feel extremely fulfilled. Time management is really helpful for me in keeping track of everything that needs to be done. But also, my husband and I don't have family that live in this area. So we have a wonderful nanny who works very long hours with us and really helps to keep our household running. My husband does travel a lot for work, so he's not always necessarily here either. So we just do a lot of planning, and then with our wonderful nanny, it helps make everything run. So
beautiful. So besides all of the amazing things that you guys just heard of what she's up to, she's also a plastic surgeon. So she's in her office doing amazing procedures, abdominoplasty, liposuction. One of the things that I noticed that you're doing a lot is Renuvion, or the skin tightening treatments. So that is something that all of my girls are talking about. They want the liposuction with the skin tightening. But one of the things that we don't talk about as much that I want to talk about, because I just it's at the top of my brain, is the recovery difference between regular liposuction and liposuction with Renuvion.
Oh, great question. So in our office, we actually focus on awake liposuction, which is amazingly helpful in helping to promote quicker recovery times. So I can just tell you, amongst all of my patients that have had the combination of liposuction and Renuvion, which in our office we call it X-Sculpt, it's our name for the combo, they typically tell me that they're sore for a few days and then they're fine. And I actually don't prescribe any pain medication for them. Of course, if somebody called and said, the Tylenol's not working, please give me something else, of course I would. But I've actually never had anybody ask. Like, they do fantastic just on the Tylenol. And the Renuvion is amazing because in many individuals, it can really potentially it just really improves like their overall results and their outcome. I always tell my patients, you do need to be patient with it. Technically, Renuvion takes 6 to 9 months to get that full skin contraction and to get that full collagen and elastin build. But people start to see the results very, within the first few months, and then their progress continues to get better.
I love that. I love to see the results. And I think it's funny because I actually had one of my clients recently going through the process, and she was like, I don't see any change. I don't see anything. And then maybe like 2 weeks later, she was like, oh my God, it looks amazing. I can't believe it. I can't believe how good it looks.
Exactly. I always tell patients, you have to be patient with the process. We do another skin tightening treatment here as well called Attiva, which is new to the United States. It's very popular in Europe, but there aren't that many people in the United States that have it. And actually, one of my colleagues who is affiliated with Tricellix actually helped to develop it. His name is Dr. Jack Zamora. He's located in Denver, and he's an oculoplastic surgeon there. And the Attiva is wonderful because it provides for skin tightening in patients who don't need liposuction in that particular area. But I provide the same type of counseling for them because it's also a radiofrequency technology, and it does take 6 full months to build that collagen and elastin. And so, sometimes when patients message the day after the procedure saying they don't see a difference, or even a week later, I remind them this is a gradual process. It will take 6 months. And also, it's hard for somebody to evaluate themselves when they see themselves every day in the mirror. And that's why the post-procedure photographs are so important, because it's a really great way of marking somebody's progress.
Exactly. I tell my girls, take those pictures and hide them in a folder in your phone, in the hidden folder. And when you're like, I don't see a difference, or I look the same, go back into that folder and look at those pictures, because you forget what you used to look like.
Oh, absolutely. I think that's a fantastic idea.
They forget what they used to look like, and then they look at those pictures and they're like, oh, actually, you know what? Yeah, I do see a difference.
Yes.
I am.
Definitely. And I think it's very common for somebody to, look in the mirror and say, oh, I don't see a difference yet, because it is hard to evaluate when you see yourself every day. And also too, people are excited to see their results and their transformations. So they want to see it as quickly as possible. So all understandable.
Stay with us. We'll be right back.
Are you living your life in clarity? Come join us as we want to help you live a life full of motivation, passion, healthy living, and spiritual clarity here on the Living in Clarity podcast.
That's right. We delve into topics such as self-esteem, dating and relationships, personal growth, and spirituality. You can always listen to the Living in Clarity podcast on YouTube or wherever you prefer to listen to your podcasts.
Come join us. We're going to fire you up.
One of the things that I tell my girls is patience is one of the things that I can put on your supply list, but you can't buy it.
Exactly. No, that's such a great point. Absolutely. And the other component of that I always tell people too is, it's not just about getting the procedure, but it's also about the pre-care and the post-care. And obviously the first thing is, of course, making sure that you're the right candidate for the procedure that you're seeking out. Because if you're not, that's already not a good place to start, but just following all of those instructions, and because they're there for a reason. They're there to help prevent complications and give somebody the best possible outcome.
So let me tell my girls, the reason why, and I think this is why you're saying this, is when you're making sure that you're the right candidate for the procedure that you're having, I think you're referring to like when people have liposuction when they really should have had a tummy tuck.
Absolutely. Yes. I think that's a really great point. I make a point of discussing very thoroughly with my patients what they can expect from the different procedures. Because in our office here, we do a lot of awake procedures, and that's really what our focus is. We do get patients who do not want general anesthesia, or in some cases, I've had patients who, because of their previous medical history, cannot get general anesthesia. And so I really spend a lot of time counseling them and letting them know if you are not able to get general anesthesia and get an abdominoplasty, or that's not something that you want, and you do want the liposuction with the skin tightening, these XYZ results are what you should expect, because I want somebody to feel fully informed and that they have all the information available to them and all of the options that are out there in front of them, so that way they can feel comfortable that whatever they've decided to do is ultimately the right decision for them.
That is I'm so glad you're bringing that up, because it is really important for patients to have options.
Yes.
Right.
Absolutely.
Everybody's different. Everybody's situation is different. And I love that you focus on the awake surgeries and on the procedure for the women who can't have those, that general anesthesia, full on tummy tuck or abdominoplasty. They can still have something, as long as their expectations are correct, as long as they know what to expect.
Definitely. And I think because we do always do Renuvion with the liposuction, that really helps to enhance the results as well. I mean, there's one patient that comes to mind who honestly would have probably been potentially offered, best treatment would have been an abdominoplasty, but that's not what she wanted. And so we proceeded with the liposuction and the Renuvion. And if you looked at her now, and she's only a few months out from surgery, she looks like she had an abdominoplasty. No, I can't say that's generalizable to everybody, because it's not, and obviously every patient's different, but in her case, that was something that, she was very excited about. So again, I try to really manage expectations and make sure people are very realistic and like what the outcomes could be.
Absolutely. And I know you're doing a good job at it.
Well, thank you. I appreciate that.
I know you're doing a great job at managing those expectations, because I like to tell my girls, like, one of the number one ways to be disappointed with your surgery is by having expectations that really weren't even realistic. Like, you were not going to get that result no matter what we did. Yes,
exactly. For example, with our Attiva procedure, and again, that's a more minimally invasive, like not a real surgical procedure, but it's still an aesthetic medical procedure. Their studies show it'll provide a 40 to 60% improvement in skin laxity. And actually, I shouldn't even say skin laxity, but skin quality. And what I also tell my patients is that if you're a vegan or a vegetarian, you'll be on the lower end of that. And so just giving them that data and that information can make them feel fully informed before they decide that they're going to pay several $1,000s for something.
So tell us why. Why would being vegan or vegetarian make a difference?
That's a great question. So because the treatment focuses on building collagen and elastin, which are two, main proteins in the dermis, or the second layer of the skin. It's really important that somebody has really good protein levels and nutritional intake. And although it's very possible to be a vegan and a vegetarian and have a very well-balanced diet and have all those proteins, there are many people out there that don't have all of the building blocks that they need to be able to get a higher level of result from that treatment. So in our office, we're very holistic in many respects. And so we actually put together a high protein meal plan that has both vegan, vegetarian, as well as omnivore type of options on there. And we send it out to the patients and let them know, these are some really great sources of plant-based protein. We encourage you, as long as it's safe and you don't have other medical problems that prohibit you from eating some of these foods, to really make sure that your protein levels are up to par, so that way you can get the best possible results for you when you get a treatment.
I love that. That's so nice. So if somebody who's listening today wants to come see you, How could they find you?
Great question. So you can find me on Instagram at Dr. Aliano Messina. That's DrAliano Messina. You can also find us at Triselects Official and also luminex.bio on Instagram. And our website is triselects.com. We also have a separate aesthetic one, luminex.bio. And then you can also call us. Our phone number is 855-874-2359.
I love it. Thank you so much for being on the show with me today, Dr. Aliano. I love seeing your growth, and I love seeing you through all of your life process and going through and getting married and having babies. And I remember when I met you, you were still at the beginning of all of that.
I was.
And it just makes me so happy to see you just blossom and be successful.
Well, thank you so much. It was a pleasure to be here today. And I'm so excited for all of your success and everything that you're doing as well.
Thank you so much. So with that, you guys, I'll see you about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Your support helps more people get real, unbiased info they need. And if you're ready to take the next step in your surgery journey, I've got you covered. Book a consultation with me at bigbuttsnolies.com and let's create a plan to get you the results you've been dreaming of. Follow me on Instagram at Big Butts No Lies Podcast, on TikTok, and on YouTube for exclusive behind the scenes and more real talk about plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.